to today's Downing Street press conference. I'm pleased to be joined today by Professor Jonathan Van Tam. Let me start by updating you on the latest information from the government's COBRA data file. I can report through the government's monitoring and testing programme, as of today, 1,728,443 tests for coronavirus have now been carried out in the UK, including 96,878 tests yesterday. 215,260 people have been tested positive. That's an increase of 3,896 cases since yesterday. 11,809 people are currently in hospital with coronavirus in the UK, down from 12,284 yesterday and 17% down since the same day last week. And tragically, 31,587 people have now died. That's an increase of 346 fatalities in all settings since yesterday. These deaths are devastating for the families, friends, and victims, and our thoughts and our prayers are with all of them every day. They also strengthen our resolve to fight the pandemic with all the resources we can muster in the weeks ahead. Tomorrow, the Prime Minister will set out a roadmap for the next phase in our strategy to tackle coronavirus. In support of this today, I'm setting out an ambitious programme to help prepare our transport network for the critical role it will play as we emerge from this crisis. Importantly, it is true to say that moving beyond COVID will be a gradual process, not a single leap to freedom. So when we do emerge, the world will seem quite different, at least for some time. The need to maintain social distancing means that our public transport system cannot go back to where it left off. And here is a very stark fact. Even with public transport reverting to a full service, once you take into account the 2-metre social distancing rule, there would only be effective capacity for 1 in 10 passengers in many parts of our network, just a tenth of the old capacity. So getting Britain moving again while not overcrowding our transport network is going to require many of us to think very carefully about how and when we travel. We've accomplished so much over the past 7 weeks of this lockdown. The whole country has been responsible for reducing COVID reproduction, or the R rate. Millions of households across the UK have changed their behaviour for the greater good. Getting Britain moving again, whilst not overcrowding our transport network, represents another enormous logistical challenge. Yet, this is a problem which presents a health opportunity too, an opportunity to make lasting changes that could not only make us fitter, but also better off, both mentally and physically, in the long run. During the crisis, millions of people have discovered the benefits of active travel. By cycling or walking, many have been able to appreciate this remarkably warm spring, whilst sticking to the guidelines. In some places, there's been a 70% rise in the number of people on bikes, whether that's for exercise or necessary journeys, like stocking up on food. So whilst it's crucial that we stay at home, when the country does get back to work, we need to ask those people to carry on cycling and walking, and for them to be joined by many others as well. Otherwise, with public transport capacity severely restricted, more cars could be drawn to the roads of our towns and cities, and they would quickly become gridlocked. We also know that in this new world, pedestrians will need more space. So today, I'm announcing a £2 billion package to put cycling and walking at the heart of our transport policy. To set out how we deliver this, we'll bring forward a national cycling plan for publication in early June, in line with the statutory cycle and walking investment strategy to help double cycling walking by 2025. The first stage, worth £250 million, is a series of swift emergency interventions to make cycling and walking safer. Pop-up bike lanes, wider pavements, cycle and bus-only streets, all examples of what people will start to see more of. And accompanying the new money, we are today publishing fast-track statutory guidance effective immediately, requiring councils in England to cater for significantly increased numbers of cyclists and pedestrians and making it easier for them to create safer streets. For employees who want to start to cycle to work but don't have a bike right now, the popular Cycle to Work scheme already allows employees to save between 25 and 39% of the cost of a new bike, or indeed electric bike. There's been a huge increase in people using this scheme, and we'll work with employers to increase uptake even further. And for those who may have an old bike, perhaps in the shed, and want to get it back to a roadworthy condition, there'll be a voucher scheme for bike repairs and for maintenance. Plans are also being developed to boost bike fixing facilities across the country. What's more, over the next few months, we'll set out further measures to make a once-in-a-generation change to the way that people travel in Britain. This will include tough new standards for cycling infrastructure, a new national cycling champion to inspire us, much closer links to the NHS with GPs prescribing cycling to help get us fitter, legal changes to protect vulnerable road users, at least one zero-emission city with its centre restricted to bikes and electric vehicles only, and the creation of long-term cycling programme and budget, just like we have already for our roads. There's clear evidence, not least from the time that the Prime Minister was Mayor of London, that making streets safe for walking and cycling is good for retailers, good for business, and very healthy for the economy. And in making these changes, our national recovery can also become a green recovery as a result. One of the few positive benefits of this crisis is drastically better air quality, the health benefits that that brings. More than 20,000 extra deaths a year in the UK are attributed to nitrogen dioxide emissions. We want to try to preserve this cleaner air. So today, I'm also fast-tracking trials of e-scooters, bringing this programme already underway from next year forward to next month, and extending those trials to from 4 local authorities to every region in the country that wants them, in a bid to get e-scooter rental schemes up and running in cities as fast as possible, helping reduce car use on shorter journeys and taking some of the pressure off the buses at this vital time. These trials will help us assess the safety benefits together with their impact on public spaces. Now, we know that the car industry has, of course, been very badly hit during this crisis. But April's new sales figures showed us that for the first time ever, that the 2 biggest selling models were both electric vehicles. So to keep this quiet, clean car revolution going, I can also announce today £10 million of additional support for car charging points on our streets. The car will remain the mainstay for many families, as well as backing electric infrastructure. Therefore, we're also going to accelerate the filling of potholes that plague so many road users in all the forms. And just as new technology is changing the vehicles we use, so digital technology will help us to be more informed about the choices we make to battle against COVID, at a time when transport demand could quickly become overwhelmed, the capacity not being there, and we need urgent access to real-time travel information. It is crucial that we take advantage of the UK's digital expertise, therefore. With the right mobile apps, people can find out which parts of the transport network are overcrowded and avoid them. They can choose alternative travel options to help maintain safe distancing, or they can get information to help stagger their journeys and lift the burden on public transport at peak times. So this week I chaired a round table with key players like Google, Microsoft and British firm Citymapper to develop both data and apps to help the public view crowding across the transport network and in real time. This £2 billion announcement represents the most significant package of cycling, walking and green travel by any British government. Clearly, it will never be possible to cycle, walk or even e-scooter everywhere. Cars will remain an absolutely vital form of transport to many. And so in the coming days, and as we look to the future, there will be further announcements about the huge investments we're making in roads and in rail, taking advantage of the low usership during this COVID crisis. Finally, as we begin the process of preparing public transport to get Britain moving again, no one should underestimate the sheer scale of the challenge ahead. Even with every train, bus and tram fully restored to service, this will not be enough. Social distancing measures mean that everyone who travels will need to contribute to meeting this capacity challenge. Changing our behaviour is the single biggest thing that's beaten back this virus. The welcome fall we've seen in deaths is not only an achievement of the doctors and nurses and care workers, but everyone in the country for following the stay-at-home guidance. To reiterate, nothing I'm saying today changes these basic rules. But as we contemplate the future, we will have to carry on making changes, particularly after we leave our homes. Preventing overcrowding, which could lead to a second spike and more deaths, will be the responsibility of each and every one of us. So please, only travel when you need to, be considerate to others, and help prioritise essential workers. And let's all play our part in ensuring that we're able to get Britain moving safely again when that time comes. I'd like to now turn to Professor Jonathan Van Dam.
Thank you and good afternoon. I'm going to do the daily slide update now. So to remind you all again that our 5 tests for adjusting the lockdown are NHS capacity, a falling number of daily deaths, reliable data showing us that infections are decreasing, getting testing and PPE supply in exactly the right place, and being absolutely sure that we have the room to manoeuvre in such a way that we do not risk a second peak of infections that threatens the NHS. Those are and remain our 5 key points. Next slide, please. Now on this slide, which shows transport use in Great Britain since the lockdown started on the 23rd of March until a couple of days ago, you can see that the British people have continued to be remarkable in showing enormous restraint in terms of travel. The figures for buses, for tubes and for National Rail are extremely impressive. If you look at the motor vehicle trend, the larger blue line at the top of the graph, you can see that there is a gradual increase over time. The trend is up. And this may reflect that some people are now returning to work who made the decision to stop at the beginning of lockdown, but were perhaps never obligated by the guidance to actually stop. So it's a difficult trend to interpret, but it is slightly upwards. Next slide, please. Now this slide shows daily tests from the 6th of April to the 9th of May, and it is tests completed and sent out. And you can see that we are now really at a high plateau in the region of 100,000 tests per day. There is some fluctuation, and quite frankly, I expect there to be some fluctuation on a day-to-day basis. So I don't think we can read too much into individual day-to-day variations, but the macro picture is that this is now at a much, much higher level than it ever was at the beginning of this crisis. Next slide, please. On new cases, you can see the growing contribution of the Pillar 2 testing arm, mass swab testing by universities, research institutes and companies, supplementing the blue columns, NHS swab testing, and you can see still that we are encountering several thousand new cases per day. Now, these data are difficult to interpret because, of course, if you compare our testing capacity at the beginning of this pandemic to where we are now, we have so much more capacity now, and that will be reflected in our ability to detect more cases. So interpret the data here with a degree of care, please. Next slide, please. This slide is familiar to you again. You've seen it many times before. It is the number of people in hospital with coronavirus in the UK. And you can see now that broadly, nationwide, there is a solid decline right across the different regions. I am confident that R is less than 1 overall, that still means that we have to be very cautious and careful and measured about what happens next. Next slide, please. If you look at critical care beds and the occupancy, you can see that across the 4 nations we have plenty of capacity for managing patients who require critical care, and the proportion of those beds occupied by coronavirus patients continues to decline. Next slide, please. On deaths, you can see really since the middle of April that there has been and there continues to be a steady and consistent fall in the number of recorded deaths due to COVID-19 in the UK. Next slide, please. And then finally, this is the global death comparison that you have seen before. All lines begin on the bottom left-hand corner at a point when 50 cumulative deaths were recorded in each of the countries. And it continues to tell the story that I have illustrated to you in previous press conferences, that the United States is an outlier at the top, that the UK is in company with France, Spain and Italy in the middle band, and there are other European countries and South Korea along the lower trajectory. These data are always difficult to interpret. Every time I want to say it, that we will not get the most granular picture until we start to get excess mortality data across all of these countries, and that will help us make a far more accurate comparison. Thank you, Secretary.
Jonathan, thank you very much. And I want to go to the first question from a member of the public, Stephen from County Durham.
Good afternoon. I live in the northeast of England, 175 miles away from Edinburgh, and double that distance from London. Should I follow the advice of the First Minister for Scotland or that of Downing Street? Thank you.
Thank you very much, Stephen. Well, look, the answer is actually, I think the 4 nations, Scotland, Wales, Northern Ireland and England, have actually largely moved in lockstep. You'll hear from the Prime Minister tomorrow night at 7 p.m. And we do want to, of course, make this as straightforward as people, as indeed this message in front of me has been all the way through, to stay home, protect the NHS and save lives. And so the next phase of this will also involve some very clear messaging, and you won't have to wait very long to hear it either. So thank you very much, Stephen. Turning to Tammy from Bristol, I think it's a written question. Tammy asks, opening schools and colleges is a very important topic for many people, but how do you plan to implement social distancing rules in education settings? Children, especially primary age and younger, will find it difficult to keep these rules. It was a very good point, of course. Again, to repeat, the first point is we need to wait to hear from the Prime Minister tomorrow night. But the wider point is, of course, there are ongoing discussions between my colleagues in education and schools, and teachers and the unions, and, of course, with our scientists as well, to work out the best way to bring schools back when that happens. But, Jonathan, perhaps I can ask you to comment.
Yes, so the point that Tammy is making is that young children do find it difficult to keep rules, any kind of touching or distancing rules, and that's an accepted fact. We've all encountered young children and we completely understand that. What I can say is that whatever the Prime Minister announces that we will do next, it is going to be extremely cautious and extremely careful and extremely painstaking. And it has to take into account the kind of factors that have been mentioned in the question. And indeed that advice and that policy will do that. But it's caution all the way, really.
I think that's absolutely right in answer to Tammy. Extreme caution is actually the watchword on this. And we've seen in other countries where second, not quite spikes have come along, but where social distancing has been relaxed and there have been problems, so we will wait to see. Can I turn now to Ben Wright of the BBC?
Thank you. Secretary of State, can you confirm that anyone flying into UK airports will be told to quarantine for 14 days from the start of next month. A lot of people will wonder why this wasn't done weeks ago during the peak of the pandemic, and won't such a move damage the aviation industry even more?
Thank you very much, Ben. Well, look, throughout this crisis, and particularly at the beginning, and particularly in reference to that question, we've sought and taken medical advice. In fact, I remember asking the Chief Medical Advisor exactly about this point. The thing is that very few people are travelling by comparison to normal, and particularly at the beginning of this crisis, most of them were Brits returning from abroad, possibly ranging in the numbers of about 3 million in that time, others who would be permanent residents here, and of course essential workers who are providing fixes for freight and supply and medical equipment who we'd need to and want to have travelling. So the medical advice didn't support it, but I think it's worth pointing out we did in fact close off quarantine anyone from Wuhan in January, from Iran, northern Italy and South Korea in February, which people may not have realised at the time. But now we have a situation where, as we get the R number, the reproduction number, down in the UK, and we begin to get things under control, we now have the capacity, as we just discussed in testing as well, it clearly then makes sense to look at what happens at the borders. I can't confirm is the answer. You will have to wait for the Prime Minister tomorrow night, Ben, but it does mean that the capacity to do those things exists, but also that the science would back it as well. I'm just going to ask Jonathan Van Tam to comment on the science of it as well.
Yeah, so I'll just going to comment on the science of quarantine and leave the announcements for later. The incubation period of this disease is very clearly understood to be between 1 and 14 days. That is to say, from the point of a critical exposure to the virus, you remain well from 1 day to 14 days before your symptoms emerge. And typically, the mean incubation period is 5 days. So that will be a typical wait, if you like, between when you were exposed and you became infected through to when you get symptoms. If people go home, as we asked them to do when they returned from Wuhan at the end of January, and they stay in their own homes for 14 days, even if they were infected very shortly before they came into the UK, then they work out that incubation period at home, and they do not spread the virus onwards into the community. So that's the scientific basis of how quarantine would work in this circumstance.
Thank you very much, Jonathan. I would add, Ben, but I'll come back to you. I think bearing in mind the sacrifice the British people have made this last 7 weeks and counting, we can't have a situation where everyone else is being asked to stay at home, but others could come into the country. It's also worth pointing out that the numbers coming to the country are very, very small, but it is a question of that judgment. Ben, can I go back to you?
Yeah, just on the sort of the clarity of the message. On the one hand, you're now talking about quarantining people, which is a tightening of restrictions. On the other hand, saying to people they can now go and visit garden centres, which is a loosening of the lockdown rules. I just wonder if the government's messaging strategy isn't now looking more confused.
No, I think that most people are more than sort of capable of understanding what's meant. And as the First Secretary said when he announced the 5 principles of the NHS coping, making sure that deaths are consistently falling, making sure the R rate is falling, that we have the capacity for the test, and most importantly of all, that we don't then have another spike when we change social distancing. And he said at that time, there will be some places where we will wish to tighten. There'll be other places, of course, where social distancing or our habits or the message may change or loosen. So I think it's completely consistent with the plan. But as I say, you will have to wait till we actually have formal announcements on any of this before any of that's confirmed. Thank you very much indeed. Sorry, Jonathan.
Maybe I could add just that, as I understand it, the policy is actually still quite consistent. We've announced testing and tracing, that will roll out in due course, and that will mean that we identify cases and we ask contacts to go into home isolation for 14 days, just the same as would apply if somebody crossed our border. So from that perspective, I think there is a real consistency here, and the difference you're hinting at is a kind of blunderbuss approach of it applies to everybody, versus hopefully a more filtered way of doing exactly the same thing.
Ben, thank you very much indeed. Can we turn to Carl Dinnan from ITV?
Thank you, Secretary of State. The airlines and the airline industry fear that they won't have an industry left if this lockdown and these quarantine arrangements continue for any great length of time. Can you confirm whether you're still open to negotiation on this quarantine arrangement with the airlines and the industry, or have you made up your mind?
I would say nothing has been announced at all as yet, in fact, and we will have to wait for those announcements. But I just want to say with regard to the aviation sector, because you're absolutely right, when it comes to, if you think about sectors that have been affected, obviously leisure, entertainment, those sort of things, and aviation would be right up there with them. And it's both a short-term problem, people aren't flying now, and a longer-term recovery issue for them. So it's worth just recalling that the Chancellor has made some very, very important packages available, not just furloughing of staff, but also the loans that have been made available. But actually also, in addition to that, the Chancellor and I have approached the entire aviation sector and said, look, if those things don't work, if that doesn't fit the bill, then for this sector, because we recognise what's happening, you can get into bespoke conversations, and that is happening in a number of different aviation cases. But I mean, it is undeniably the case, of course, that aviation has been right at the forefront of this. We have to, first and foremost, make sure that we develop policy in the public interest. And that, of course, as everybody knows, is protecting the NHS and saving lives. Do you want to come back on that, Carl?
I wanted to ask about your announcement on cycling, actually. The extra investment in cycling would be very welcome for those who are able to cycle to work. But as you will know, the average commute in this country is nearly 9 miles. There are many people who just can't cycle to work, even if they want to. And you've admitted that all the transport, public transport capacity won't be enough if it's brought back online. What are you doing about that?
Yeah, I mean, you raise an excellent point, and I hope that in my comments I covered it a little bit in saying that I'm going to come back and talk about the infrastructure investment on roads and so on and so forth. Absolutely recognise that car will be a vital part of what's required. But I do just want to kind of pick you up on one stat. Outside of London, it's been shown that half of journeys are under 3 miles. So you don't have to be a cyclist to benefit from society as a whole switching to cycling and walking. So to give you an idea of what that meant, if only 5% of those journeys were cycling, so if cycling increased by 5%, I should say, it would mean 8 million fewer car journeys, 9 million fewer rail journeys, and 13 million fewer bus journeys. And that's just a 5% increase in cycling. So you don't have to be the cyclist to benefit from that, and that's why I was saying in my comments, I very much like people to be thinking about alternative and active forms of transport today in order to protect the total amount of public transport that will be available once you include social distancing within it. Carl, I can come back to you if you wanted to respond.
Well, that still doesn't quite answer the question about public transport capacity, which, as you've indicated, is going to be a very, very serious problem, especially in the southeast of England, of course, but all around the country.
Yeah. So there is no simple answer, and I'm here to sort of just give it to you straight. There is no simple answer. If you think about the figure of only space for 1 in 10 commuters if you keep social distancing, which of course we must, and Professor Van Tam will tell us why, then it does restrict space, which is why I'm here today providing some notice that it's very important that we all think about how we get about. And when you think about that figure of, almost half of journeys being just 3 miles, it's quite clear that there are the ways that people could travel quite a bit of the time. And even if you're not a cyclist or a walker, it would help the whole of society. Thank you very much indeed. Can I turn to Ben Kentish from LBC?
Good afternoon. Thank you, Transport Secretary. Given the quarantine arrangements we've been talking about and the other uncertainty about travel, can you level with people today, and given the uncertainty facing the tourism industry and individuals, say to people that realistically foreign travel this summer is going to be highly unlikely? And would you advise people even now to start cancelling trips? And just secondly, if I may, to Professor Van Tam, it's become clear, it has been for some weeks now, that the driving force of this epidemic is now really transmission within care homes. I just wanted to ask, why has it been so difficult to protect some of the most vulnerable people in our society, those at highest risk from this disease, i.e. people in care homes? And what more, if anything, do you think needs to be done to achieve that? Thank you.
Thank you very much, Ben. Look, on summer holidays, it is a fact at the moment, unfortunately, that the advice hasn't changed. We have to stay at home, so you can't travel around this country at the minute. That advice, we will have to wait to see if it's updated. In terms of international travel, of course, the Foreign Commonwealth Office is advising strongly against all travel internationally at the moment, and people will of course have to have that in their minds before they're able to book anything. Of course, also in countries where people might normally go to visit, they're also not accepting people in many cases. So it's difficult to give blanket advice. The situation is as it is at the moment, and we will have to see how the reproductive rate of COVID-19 continues to proceed before we'll know the answer from here, standing here at the beginning of May, to know how that will look in the summer. And on care homes, that was to you, Jonathan.
Yes, thank you for the question. Look, I recognise that there has and continues to be a difficult situation in care homes, and I'm extremely sorry for the many deaths that have occurred. However, care homes are a really difficult situation from a basic infection control and epidemiology point of view. First of all, here we are dealing with a virus that is very infectious. The R0, if left unchecked, is somewhere between 2.8 and 3. It's high. We are dealing with care homes with a largely indoor environment, and we do know that this and many other respiratory viruses spreads more easily in indoor environments. We are also dealing with, by and large, a very elderly population in care homes. And my colleagues who run the COSIN analysis are very clear that there is an independent effect of age on the risks of COVID and the severity and the death rate. And that is now very, very clear indeed. And roughly with each 10-year age band, it goes up and up. And on top of being elderly, many of the people living in care homes have other underlying conditions. And again, the analyses are very clear that you have increased risk of complicated disease, increased risks of death, again, associated with a range of underlying conditions. So you almost have the perfect storm of a really nasty virus that's infectious, a very elderly population, and we know age increases risk, a population with many underlying illnesses, risk conditions that again further increase risk, and to an extent, an indoor environment. So it's just a very challenging place to work in. Now, in terms of what is being done about it, my colleagues at NHS England and the Care Quality Commission are now really putting an enormous amount of effort into solving these problems and giving as much advice and support as they physically can.
Jonathan, thank you very much. Ben, thank you as well. Turning now to Nigel Nelson, Sunday Mirror.
Yes, thank you, Secretary of State. As a follow-up to Tammy's question, would you accept that parents won't be able to cycle into work until schools are fully up and running? And also to Jonathan Van Tam, what's going to happen to the 1.8 million shielding when the volunteers they rely on also go back to work?
Nigel, thanks very much. I mean, I think you rightly point out the interconnectivity of our economy and also this enormous and unprecedented situation we find ourselves in. I think it is true to say that people have, through this crisis, have found a lot of different ways of working, and many more people than ever thought it was possible have discovered they've been able to work from home. And I imagine that quite a lot of that will continue, and possibly for quite some time, particularly as social distancing remains at the heart of making sure that we proceed with extreme caution, which is absolutely our desire. So, look, of course it is the case that all of these things have to fit together. They have to fit together in a certain pace, so schools going back, work going back, and so on and so forth. And it is why, if I may say, the Prime Minister will be speaking to us at 7 p.m. tomorrow night to set out how that roadmap will fit together in the medium term. And to you on the second point.
So, thank you for the question. Shielding is an extremely important part of what we've been doing to protect the most vulnerable in our society during the first part of this pandemic. I believe it's likely to have had a major effect on the number of severe cases in the shielded population. I believe it's likely to have prevented many deaths in that population. We do keep the shielded groups under review, and we do keep how we are going to move forwards with the shielding policy under review. But I can tell you that nothing we will do in the future will ever sacrifice the public health and clinical importance of continuing to protect the most vulnerable people in our society.
Jonathan, thanks. Nigel, did you want to come back?
Only just to check the order of events, which is what I was trying to ask about, that without schools, wraparound childcare, breakfast clubs, school clubs, then the whole idea of starting to talk about people going back to work is a bit premature. And so I'm just trying to see if you would agree that schools are the priority before we can do the next stage.
In a sense, I'm trying to actually raise this subject ahead of time, Nigel, because as I described in my comments, I think it's very important that people are starting to think about the reality of how journeys may need to work in the future. So you're right to say that this is sort of projecting forward rather than something which is right now at this moment, but as I say, if I can just appeal to your patience for just over 24 hours to hear from the Prime Minister tomorrow, I feel you'll be in a much happier position about how that all fits together as he presents us with that roadmap. Can I turn now to Toby Helm from The Observer?
Hello, question first of all for Secretary of State. Last week, a number of media outlets, including the BBC, were confidently asserting that the government would drop its stay-at-home message when the Prime Minister makes his announcement tomorrow. More recently, and since then, there's been a much stronger evidence on how cautious the government wants to be, which would suggest perhaps that it's not going to drop its stay-at-home message. We are in the middle of a bank holiday weekend, very sunny weather. I know you'll try and say that the Prime Minister, you must wait for the Prime Minister's statement tomorrow, but there's more than 24 hours to go, and a lot of people will be wanting to get out into the parks and to have a good time. And from my own straw polls, I've heard a lot of people saying already that they think the lockdown basically is going, so they might as well go out. Could you tell people before tomorrow, and they have to make the decision what to do, should they be staying at home or should they not be staying at home?
Toby, it's just absolutely unequivocal. People should stay at home. Please follow the guidance. It's still written here. That hasn't changed. And it's vital that we don't throw away, essentially, the great work of 7 weeks of people respecting, very impressively, the rules and the guidelines by throwing it away because it happens to be sunny outside this weekend. That would be absolutely tragic. And when, as we hear the Prime Minister, and as I've tried to suggest in my comments earlier, that does change, we will have to proceed with an unbelievable degree of caution. We will not be able to simply go back to business as usual or transport as usual in my case. So your point is very well made, and the answer is simple. Please stay at home this weekend in exactly the usual way that you have been previously.
Okay, could I just fire one at Professor Van Tam as well? We've talked to lots of scientists who confidently said that in order for the government's track and trace system to be effective, and in fact for it to operate really at all, the numbers of new infections have got to have come down into their hundreds. Now they seem to be hovering around 4,000 at the moment. Do you agree with those scientists that for the track and trace to really work, we have to have new cases of COVID-19 down in the hundreds? And if so, how long do you think that will take?
Okay, so test and trace is going to be a system that involves the NHS app, and it is also going to involve Public Health England in wider traditional contract tracing using telephones, foot leather epidemiology, and the way it's always been done for many years. Now, those two together make a package of test and trace, and we have been very clear that test and trace on its own is part of the solution to how we continue to live with this virus after the lockdown that we're in at the moment. It's not the total solution. And let me try and get this right. How extensive the test and tracing needs to be clearly depends upon the level of disease in the population. But it is entirely appropriate to see it as part of the overall measures that will give us more flexibility and more room on what we can do in the social distancing space to ease things. But on its own, it's a contribution. It is not a total solution.
Jonathan, thank you very much. And Toby, I can also tell you, I know that the trials in the Isle of Wight of that tracking app, the NHS X app, designed to help assist people, is going well. People have been downloading it enthusiastically, and I know that the plan is later in the month to make it more widely available as well. Can I turn to Shailesh Sri Lanka from Eastern Eye?
Thank you, Secretary of State. The latest ONS figures show that members of the Black and South Asian communities are dying in significantly high numbers from the coronavirus. Most live in extended families and are key workers. The government inquiry will report at the end of the month, but in the interim, what practical steps has the government undertaken to protect South Asian key workers and their families? Secondly, one more question, please. Secondly, we know from our sister publications, Asian Trader and Pharmacy Business, that over 75% of all convenience stores and 50% of community pharmacies nationally are owned by the Asian community. We know pharmacists are key workers, but will the government consider including convenience retailers as key workers and provide them and pharmacists with good quality PPE so they can continue to serve the nation? Or, as some of our readers have suggested, would the government rather see convenience stores and community pharmacies close so they could stay alive?
Thank you very much indeed, Shailesh. Look, I think we're very concerned about deaths amongst minority communities, the South Asian community included, and we're very, very interested to understand why that is happening. And at the moment, we're unclear whether that is just the proximity, in other words, that more people from minority backgrounds happen to work in health and social care, or whether there's something else going on. It actually opens up wider questions as well beyond this of, why it is that men are much more likely to have higher mortality rates, or obesity seems to be a factor, and many other things besides. So we have asked Professor Fenton from the Public Health England to look into this and carry out a quick study. Results, as you mentioned, will be at the end of May, and I think we'll be in a much better position to understand this better. But be in no doubt at all, we are absolutely determined to get to a proper understanding of what has been going on there. And in relation to your second point about ownership of whether that's stores or pharmacies, look, I think everybody on the front line are key workers. They are keeping this country running at this incredibly difficult time, and it applies to people in many different sectors, but you've mentioned two which are first amongst equals. And of course, we want to get the right protection for people in different settings. We know that in a health setting, the PPE required is of a different level. It might be best for me to, therefore, as a medical sort of question, ask Jonathan to comment on this.
Yes, thank you, Secretary of State. I'll pick up on the question of black and minority ethnic groups and the ONS report. Thank you for the question. I've read that report. I take it very seriously indeed, and there is an enormous determination across the medical advisory function for the government to get to the bottom of this and get to the bottom of it with real clarity. And that's why I don't want to come on here today and offer you kind of silly quick fixes. This is a complex mixture of risk by age, risk by gender, risk by comorbidities, other illnesses. There is an obesity signal beginning to emerge as well. And on top of that, and I'm absolutely clear, there is a signal around black and minority ethnic groups. No one, I think, is trying to brush that under the carpet or say it's not there, but it is complicated. And to give you some idea of that complexity, right now I can't stand in front of you and say that I could easily make an on-the-hoof judgment about who is more at risk, somebody from the black and minority ethnic community who is svelte, age 50, a regular half marathon runner, eats well, does everything right, versus somebody who is from a white ethnic group who is 32, who is extremely overweight, doesn't exercise, has diabetes, has asthma, etc., etc. Those are just silly examples, but they're ones that I hope give you an understanding that pitching the risk for individuals is quite a difficult and technically involved thing to do, and that's why I don't want to make any quick jumps and quick quips of answers to you. I'd rather say to you that we are taking this incredibly seriously and we are determined to get to the bottom of it in a proper and scientific way.
Charlotte, I just want to be absolutely back up what Jonathan said. We absolutely will be led by the science on this, find out what's going wrong, and we owe it to everybody who's put themselves on the front lines to find out exactly what's happened. Did you want to come back in?
Yes, I do. Thank you. We appreciate that it's a hugely complex issue, and given that the inquiry was first announced on the 16th of April, it's going to announce now its findings on the end of May. People are actually dying now. There's a great deal of anxiety within BME communities, and all they're asking for is practical advice, practical steps as to what the government is doing to protect these lives. There's a huge amount of anxiety.
Yes, indeed. And look, we need to get to the facts to understand this. But I think the advice would actually be the same as the advice all round: washing hands, making sure that appropriate PPE, to go into your second question, in the right circumstances is worn. And as I say, bluntly, finding out what is actually going on. And that is a very rapid piece of work that's going on, and I'm sure we'll be hearing from Professor Fenton the moment he can bring some clarity to exactly what has happened. Jonathan, I don't think there's anything else you can add to that.
I just can't tell you how urgent it is, but I can also tell you it's not so urgent that we want to make mistakes, and we want to be very, very clear about the science with you.
Thank you very much indeed, Shailesh. And I just wanted to finish by saying I talked a lot about the future this afternoon and some of the measures that will come into place, but please, this advice hasn't changed. Wait for the Prime Minister tomorrow night to set out the roadmap going forward. What I would ask you to do, regardless, is think about the future, about alternative and active means of transport, but we will be proceeding with extreme caution, maintaining social distancing as one of the absolute key ways to beat this virus in order that we can get Britain moving again. Thank you very much indeed. Thank you.